Well, good evening, everyone. This is Dr. Ellithorpe, and we are on Ask the Doctor Anything. This is a time where Tustin Longevity Center, the name of our clinic here, opens up to talk about any kind of medical question you might have. Again, this is not meant to be treatment over the YouTube. This is just meant to get my experience, my opinion on the functional medicine, integrative, natural approach to management of symptoms or disease problems. Uh, we will give you our general concepts. Of course, you should, if you have these problems, talk with your doctor. If you are my patient or a patient here, again, you should put your questions in through the phone or text your question to us so your doctor or I can get to your question specifically for you. But here we do general type questions. You can be live here and type in your questions about certain healthcare issues or concerns in the YouTube chat area. So we tend to do the live patients first and answer their questions. Or you can give us your typed in questions, which if you go to our website, tlcdoctors.com, tlcdoctors.com. You can get on our newsletter and be alerted to our upcoming YouTube channel, Ask the Doctor Anything, every Tuesday at 6 o'clock to 7 p.m. When you do that, then you'll be notified and there'll be a link there. So if you have a question, you can type in your question. There's a limit to the number of characters, or in other words, how long your question can be. But in general, you can type it in and then it'll get printed out for me right after work and just before this program starts. So I'll do my best to give you my impressions. I don't know everything. And so if I don't know something, I will tell you that, or to recommend that you see a specialist concerning some kind of a question that I wouldn't be familiar with. But talking about lifestyles and taking personal responsibility for our own health, there's always a very good way to begin any health journey, and that's accepting your responsibility to the type of health care and how you would like to be managed. There are those who just want the doctor to tell them everything, and then they'll follow up at the appointment and do exactly what they say. And then there are other patients who want to say, what is my role, or how can I help in my health journey to preserve my health or to restore my health? And so we emphasize the cooperative relationship here, doctor to patient, patient to doctor. So we're going to give you any suggestions that you can do to go on your health journey and improve it. So let me get my chair adjusted here a little bit better. And so we're starting to get in some questions live. So I'll go to that now. Again, if this is of value to you, please take the time to like and then refer or subscribe to the channel and help your family and friends have opportunity to maybe like or listen or read our transcripts, because we do the transcripts of this after each event. So you can just read through the questions, and those questions that seem interesting to you, if you go to our website at tlcdoctors.com, you can look at the blog and you'll see those questions and just read the answers that I have for it. So our first live question is from Beth. Beth is saying a quick question about taking Juice Plus. Do you think it makes the urine much more of a yellow color? Yes. And you know, the B complex that you'll find in many vitamins will give the urine that kind of yellow chartreuse kind of color. So the answer is yes. And I endorse, I recommend the Juice Plus capsules. I don't recommend the gummies or any of the other products because the science needs to be there enough for me to endorse them. But I have for, I don't know, maybe close to 30 years now, or at least nearing 30 years, been using the capsules of the Juice Plus, and it's antioxidant, polyphenol, oxidative protection from membrane damage to the cells is just un copied. There's no one who has produced a supplement with more research and literature on so many of the anti-aging benefits that Juice Plus, the fruit, the vegetable, and the berries provide. Um, the next question we have is we'll go to our our email. Let's see. Sharon is asking the question: is it too late for an 80-year-old woman to start hormone replacement therapy? That's a wonderful question, Sharon. And the answer is no, it's never too late to start hormone replacement therapy. And that's for a multitude of benefits, from cognitive memory issues to immune support, cardiovascular support, the integrity of your skin from your face, your head down to your toes. It helps your bone health. It helps your immune health. So I absolutely recommend you discuss with your healthcare provider natural hormone replacement therapy. I prefer topical creams, especially we would like to check the dosing, and the uh, creams are adjustable, whereas if you get a patch or a pill, you're kind of stuck with that one thing. When we have creams, we can use more of the cream or less of the cream until we find out what works and is comfortable for you, and with a lab test to confirm the estradiol range that we would like to achieve. And I'm going for somewhere in the realm of around 70 to 150 nanograms per deciliter of estradiol, and then the progesterone I would go for at least 4 picograms per deciliter, and as high as 40, 50 picograms per deciliter. We want the progesterone effect to be there to prevent estrogen dominance. God gave us a cycle where we would ovulate, and with ovulation, you produce progesterone. Progesterone has a blocking effect, you might say, of the estradiol. So we like that balance between the estradiol and progesterone. And so we give both. I take mine. I'm 72 and I use my progesterone. I'm on it right now. I use it the 1st through the 15th of the month. And I'm on estradiol every day of my life, because when you start to mature as a young woman, your estradiol is continuous, although it has some undulations, but you have estradiol all the time, whereas progesterone is really a come and go cycle, 2 weeks out of every month, 2 weeks off, 2 weeks on, if you're ovulating. And so, yes, it's quite wonderful, and work with your healthcare provider. I recommend the creams and get all the benefits from it. And see if you're a good candidate. I can't think of any reason why you wouldn't be a good candidate. Um, so yeah, talk with your healthcare provider. Let's see, on the live questions, we're getting more in. SBM Jen says, what recommendations do you have for skin issues, scabbing, blemishes on the forehead that never go away? I want to address the root cause. Dermatologists haven't been able to figure it out in 15 years. Well, I guess the first thing I'm thinking about, SBM Jen, is this a skin cancer? If it's a non-healing site, then you always want the dermatologist to do a look and see, and maybe biopsy to make sure it isn't a basal or squamous cell cancer. But if it's not those things, and if it's like a rash, autoimmune phenomena, a food allergy rash, usually we start from the gut. And I would, in general, the most immune calming, food allergy eliminating diet that you could go on would be a carnivore diet for, say, 3 months. And that way, all the protein and fatty acids that would help heal the lining of the gut, because we feel most disease comes from a breach of that tube, the lining of your tube. And with that breach in the wall of your gut, food leaks through, your immune system is alarmed, and there's a lot of molecular mimicry across communication, and the immune system will attack parts of your body, your joints, arthritides, your skin, dermatitis, your nerves, neurological MS, and Lou Gehrig's disease. I mean, this cross reactivity of the immune system needs to be understood. And so, the most calming thing you could do would be probably a 3-month carnivore diet. It takes about 3 months for a new layer of skin to grow through as well. So, all my chronic psoriatic and dermatitis patients, uh, uh, and acne and cystic acne, because a carnivore diet is extremely low carb, and that will help stop feeding the bacteria that covers us all the time. So that's the direction I would go, SBM Jen, and see your doctor and try that out. It's very healing. Now, if you're a blood type A with a carnivore diet, you'll probably need digestive enzymes to help you digest the protein and fats. And if you're over 60, usually as we age, we don't make as much digestive enzymes, and you'll need that too. I'm a B type blood, so but I still started using digestive enzymes in my late 50s, early 60s. So hopefully that helped you. Uh, Dennis asked the question, what is an ideal glucose to ketone ratio for good metabolic health? Uh, the GKI index, GKI, glucose ketone index. And so if you can get that glucose to uh, ketone index somewhere in the realm of 2 to 4, that's probably a very good range to keep it in. 4 would be um, on the high end. 2 would be more ideal. Um, so, yeah, that's the ratio. The glucose ketone index, GKI index. 2 is what you want. I've seen a lot of literature saying getting it at a 4 or less is helpful. What else is the next question? Jill says, hello, I have my next appointment with PA Gonzalez next week, but meanwhile, wondering if she's going to be able to order a Dutch test for me. If yes, is she going to be able to help interpret it? I believe she does the Dutch test. And I'm not anti-Dutch. I just don't need the Dutch test. I really have done this for so many decades that I just don't see a need for the Dutch test in my practice. You get to be in your 70s practicing medicine almost a half a century, and doing things that now are all the rage that you saw the wisdom to, many, many decades ago. You start getting, I don't know, set in your ways would be a way to say it. I should remain open to learning about it. I understand the premise of the Dutch test. I have not looked at the Dutch test with much detail or value of the cost of it to my patients, because I feel I can do what I need to do without that test and the cost of it to them. So during these past 4 or 5 years, especially, I have certainly tried to keep the testing at a minimum if possible. But yes, I do think she can order it and interpret it. And so there you go. Let's see. SPM John went on and had another question. What's better for focus and mental clarity, nicotine or methylene blue? Well, I don't think it's ever been studied one compared to the other. You're going to be stuck with just old doctors like myself that have decades worth of experience of tens of thousands and millions of patients over the past, I would say, at least 40 years, 35 years, where I've had patients on methylene blue. I've had patients using nicotine. And I think the edge and the volume of experiences for nicotine as opposed to methylene blue. Um, but anything that improves mitochondrial functions or the engine of the cell is the battery, you might say, for producing energy of the cell. That's going to improve your overall well being and every function in your body from your memory and brain function down to your toenails having less risk of getting fungal infections. So, if I had to pick one or the other, I would say out of clinical experience, nicotine. This is for a 22-year-old female with autism with blood type A. Um, the 22-year-old girl, blood type A, I would certainly probably suggest, a richer protein diet because A's tend to learn to eat a high carbohydrate or plant-based diet simply because they don't have enough digestive enzymes to digest the healthy proteins and fat that we're made of. Okay, and your brain is made of a vast amount of fats. So that's going to help the memory. The other thing is iodine. Iodine is very important for memory and mental acuity. Another thing would be B complex. Since A's don't digest well, they always have low B12 and B vitamins. So being on a good methylated B complex for the blood type A will also help energy and the function of the mitochondria of the brain cells as well as all the cells in the body. And then uh, at 22, I would say exercise. Exercise, walking would be very important, and a social group, fellowship in church or in a classroom. Friends and family is very important for memory. And let's see what else. What I would say. A low carb diet, of course, because that'll dull the brain, just like after Thanksgiving dinner, we're all tired and sleepy, clogging up our brain with a lot of sugar, carbohydrates. So that's the direction I would go. Next question is from Jill. Been on uh, bioidentical hormone replacement therapy, estradiol patch, progesterone oral, and testosterone cream, just diagnosed with atypical lobular hyperplasia with ductal involvement, estrogen positive, awaiting uh, progesterone and or HER2 pathology. So atypical lobular hyperplasia does not sound like it's cancer. I would probably go on a carnivore diet, and I would go and get a high dose vitamin C with EDTA and chelation. I would start an exercise program, both weightlifting and aerobic. I would stop eating at 3, and I would take systemic enzymes. I would use probably Juice Plus as my antioxidant, and I would use a multi-mineral rich in selenium and zinc. That's we have the TLC multi-min that does that, and I would use probably quercetin as a agent, a natural agent, which is quieting to the mast cells, the immune system. The other thing is drinking adequate water, and just probably follow that. I don't think hormone replacement has anything to do with this, in the sense that um, it's never been established or proven that hormones are a cause for breast cancer. Every normal breast biopsy of a woman without breast cancer, if you did random testing of breast biopsies, a normal woman is going to have estrogen receptor positive and progesterone receptor positive cells, and that's normal, and that's considered uh, better for management for those poor women who do get a breast cancer. The other thing important would be to be on iodine. So I would see your healthcare provider, discuss some of these suggestions and ideas that I would do for that kind of a scenario, and share it with them, and go from there, and have it followed closely. Beagle Mom says, "Hey, Dr. E, how much estradiol should I use? I want to use this. I have hot flashes even with the hysterectomy. Thank you." I would use both estradiol and progesterone because, unfortunately, the training in medical school is inadequate, and progesterone is on all your cell receptors, largely noted in the immune area and the limbic system of the body. So if you're going to go on um, hormone replacement, I usually start a woman somewhere. I like the cream, so I'm going to start with a cream because I can go up or down based on what the clinical, how she feels on it after a month or two, and what the estradiol levels are and how well her skin absorbs. So I'll say start with, depending on your age, if you're younger and you've been more close to your menstrual cycles, you're not so far into menopause. I start with a 4 milligram per gram cream, and one click of a 4 click per ml topic click would give you 1 milligram, which is a modest beginning dose. If you put it, I put it on my face so I don't wrinkle and age as much because it helps with collagen and elastin, just like it helps with building the bones and bone mineral density. So it's very good for the structure of your body as well. And then in 3 months, I would recheck it. The progesterone dosing, we usually start with 100 milligrams. And I would tell you it's probably money savings to just use it half the month, either the 1st through the 15th or the 15th through the 30th. Since you don't have your uterus anymore, you're not going to have normal uterine function and menstrual cycles. Even though I'm at 72, I still cycle every month because I use my progesterone for 2 weeks, the 1st through the 15th. And every mid-month, I'll have a little breakthrough bleeding, just like a normal uterus would behave. But that won't happen with you, so there's no reason to be concerned. And I would just probably start in that realm. I don't like patches. I don't like the unnecessary exposure to any additional plastics and topical to the skin in a human body. I mean, I do prescribe them for women who don't like the progesterone cream or the progesterone, I mean, estradiol cream, or that some people's skin is just not as absorbent with a natural Eucerin cream that I use, a very, very basic natural form of cream. So then I'll go to the patch. And the other way I would consider is oral, although that's the last thing I usually do because I don't like to get the first pass through the gut liver system, although it's been used for many, many, many decades. And I have many women on oral, and it's convenient to them and they like it like that. And I insist that they drink their water, take systemic enzymes if they're on natural hormones, because young girls have a lot more enzymes. And so that way you don't have to worry about blood clotting. If you drink enough water, you take your systemic enzymes every day on an empty stomach, a few of them anyway. You stay exercising, you eat a low carb diet, so your blood isn't sticky. And then you get all the benefits of these natural hormones without worrisome side effects. Um, let's see. SBM Jen says, is there a good menu for the carnivore diet? If so, where can I find it? I'm hoping for something easy to follow. I think we make our lives a problem by thinking there's some process. A carnivore diet is just eating ground beef or eating chicken or eating salmon or eating eggs or eating pork, bacon. I wouldn't go worrisome beyond that. You could, if you do cheese, I would get raw cheese and not homogenized, pasteurized, corrupted uh, products they call dairy, but it's not dairy anymore. It's inflammatory blocks of stuff they call cheese and inflammatory liquid they call milk from homogenization and pasteurization. But don't make it difficult. I start with roasting on the cooktop, slow cooker. I'll put in a 3 pound chuck roast I put it on some onions to get it off the base of the cooker. I'll put in a half a stick of butter, salt and pepper. I'll put it on low. I started at 9:30, and by the morning, I have all this nice roast beef ready for me. And then I'll have that and have it at lunch and finish by 3. I'll never finish that in a day. That will last me 2 days. So I eat a very uninteresting roast beef for 2 days, probably in a row. I'll get a whole chicken and I'll roast that and have that in the morning and in the evening. I mean, morning and lunch for a couple of days, and then a pork tenderloin roast or something else like that. And that'll last me 2 days. And the seventh day of the week, I'll either sometimes I fast. By the way, it's after Labor Day, and I'm on my prolonged fast, so pray for me. And I feel fine, and I've not eaten for. I'm into my second day of no food, just water. But if I don't fast on one day a week and I do eat something, maybe I'll have, a omelet, and I'll make cheese omelet with raw dairy and something like that. So that's probably what I would do. So, is there a menu? Yeah, I just labeled it to you. Keep it simple, and don't listen to all this hype of marketing of everyone with a program. They're trying to sell you something. Buy their book. Buy this. Buy that. You know what a carnivore diet is? Is it's animal food, and have 2 meals a day, and there you go. And I butter every piece of meat I eat, every piece of salmon I eat, every piece of chicken I eat. I butter it up, and so I don't butter my bacon though. All right, but if it's a piece of ham, I will butter that. Hopefully that helps you, Beagle Mom. No, no, SBM Jen. Hopefully that will help you. I don't have any referral because I don't think a referral for a menu for carnivore is needed. Now, one of the things we are doing here is my wonderful nurse, Terry Delia, has her, registered nursing degree, but she also has her nutrition coaching degree as well. And she has agreed to do some nutritional coaching. And she does have some suggestions for menus, and she's very compatible with all she's seen over these years with the wonderful health and labs and weight loss and energy restoration and memory restoration from these lower carbohydrate diets. Now, I'm not against eating plants. I will definitely have cooked vegetables, and that weekly I have that cooked vegetables. But what I want to get at is a pure carnivore diet is probably uh, my most recommendation is really 3 months, rarely at 6 months, and you can go on and off at your will with cooked vegetables and some berries for fruit if you have to. Uh, what's the next question? Rosa says, "Hi, doctor. My daughter is 40 and she is having menopause symptoms. She is currently breastfeeding one uh, time a day. Should, let's see, she be having the symptoms at her age? What tests should she get? Thank you." Well, she should see her doctor and have her estradiol measured and her progesterone and testosterone measured. She should probably get her thyroid measured and her DHEA and cortisol. She's probably, if she's breastfeeding, she's had a baby recently. She is stressed. Her Find out her blood type, especially if she's an A, because her body is given a lot to produce this baby and continues to give a lot to make all that milk. Therefore, she needs to be on a very healthy protein, grass fed, preferably prairie raised, chicken and prairie raised pork products and wild caught fish. And digestive enzymes if she's a blood type A with multi mineral, probably a multi B vitamin, and iodine. Uh, as a starter. So a multi mineral, a multi methylated B, iodine, vitamin D. That's a mood elevator, will help her with her mood and her bones during all this stressful time. And digestive enzymes with betaine hydrochloric acid if she's a blood type A. Have her see her doctor, measure those hormones, and not to eat late at night because digestion is supposed to be a daytime event, not an evening event. And if you eat much later than 5 or 6, you're going to have food in your stomach when you go to bed, and your healing and repair will be hampered. So, those are the directions I would say. And it's not unusual to see women at 40 having symptoms like that from all the stress they've gone through. But she can recover and do very well. I have some women that I will put progesterone on cyclically, and even a very gentle little low dose of estradiol cream to help them with hot flashes and stuff. And then it doesn't stop them producing their own hormones, because I've watched this over the many decades, and we can see when she makes her level. And I usually check the hormones about every 3 months, and I can help them through this turbulent time called perimenopause. So hopefully that's helpful to you. Um, Beagle Mom says, my sister had severe spasms and cramps in her hips, legs, etc. What causes that, and what can she do to help it? Thanks again. Well, Beagle Mom, I would certainly suggest drink water. Very often, the biggest issue there is not drinking enough water, and we tend to be dehydrated, especially in this hot weather that we're experiencing here in Southern California. The other thing is we are shied away and told not to enjoy salt, healthy salt. And so I do recommend my patients salt to taste and enjoy their salt, even to the point of taking Himalayan or Celtic salt and putting a pinch in their water, which I do all the time. Sometimes I'll just take some and shake it out and uh, lick with my tongue, my own palm, with my salt shaker here of the pink salt that I have. Uh, the other thing I use is the multi minerals I've referred to before. The Albion amino acid chelated amplifies the availability of absorption and is much, much better product than typical cheap over the counter products out there. All of this helps with contraction and muscle spasm, and your minerals and hydration and your electrolyte salts are very, very important. Not eating late at night is another very important thing to do. And being low carb would be very important. So, those would be my suggestions for you. Uh, Mano says, where is the best place to get Juice Plus? Well, I never actually do the paperwork, but this is something where you have to work with a distributor to order this for you. And the only thing I can tell you is you would have to call my front office here, and they can give you a referral for someone who is ordering the Juice Plus, and they will guide you through it. If you do and you have any children, my understanding is the company will give children free Juice Plus for a series of a few years if one adult is their sponsor. So, yeah, just give the office a call uh, and they'll help you with that question. Dennis says, do cigars deliver nicotine? Yes, they do. Do they deliver it faster than cigarettes? I don't know if that's ever been studied. I recall hearing that in an anti smoking ad. Um, Cigars usually are very large or thick as a general rule compared to the slenderness of a cigarette and its packing, whereas cigars are leaves that are rolled up, is my understanding. And so the nicotine is in the plant. You get nicotine from the plant kingdom every time you're eating tomatoes and potatoes and eggplants and things like that. So it's not a uh, uh, terrible molecule. It's everywhere in our diet. So go ahead and say yes. The cigars will deliver more nicotine because they're bigger and fatter in general than the cigarettes are. Now, I don't endorse the burn and the tars of plant material being inhaled in the body, and that's what I think is carcinogenic. plus other chemicals and flavorings they put into these cigarettes and cigars and products like that. So, but I empathize with the smoker. Of course, I used to be a smoker. I think everyone smoked in the 1960s when I was in high school, and in the early 70s when I was in college. Everybody, including myself, smoked, and I only stopped because I got had my children, and then I started up again in the very early years of opening this clinic. It was so stressful, and I broke down, and I started to smoke cigarettes again. And then I stopped, and I had the electronic cigarettes were starting then. Then I went to the flavorless, bland electronic cigarettes to with nicotine in it, and then I finally got off of that as well. So the addictions and habits are very difficult to break. So I'm certainly empathetic to people who are using those products. But if you, I'm all in favor of the research about the nicotine, and I use a little lozenge of that. Maybe that's why I'm able to stay away from the vaping. What's next? Let's see. Mano says, better grass-fed, full fat. Yes, I am all for grass-fed and marbled, healthy fat in the meats that I buy. But remember, marbling is amplified on many people who are dishonest and put their beef in for slaughter. But prior to that, they'll put them maybe 2, 3, 4 weeks on a very high carbohydrate grain diet. And that'll puff them up with deposition of the fats made from the sugars and all that carbohydrate grain they're eating. So you have to be careful with that. Uh, Leah says, hi, Dr. E. Thank you for being my doctor. Oh, well, bless your heart. And making such a difference in my life. Your patients are so blessed to have you. God bless you. God bless you and everyone. You know, God's greatest creation, I say it every time, is the human being made in the image of God. And so, you know, if you're only nice to people you like and people you love, what is it if they are nice and loving back to you? God says in the Bible, uh, even nasty people, or sinners are nice to one another and lend one another. Our God says in the Bible that we're to love everyone and to do good to everyone and to not to applaud sin necessarily, but our actions are to be loving toward human beings. That's for sure. And my work here is such a blessing to see the wide variety of humanity. And I have to fight my own humanness, my own aging, my own tendency to get judgmental, my own aging to be exacerbated with the corruption I see and the poor training and the harm to humanity through the healthcare system. It makes me very upset, and I have to just get myself calmed down and let God be in charge, and just one at a time be forgiving and loving myself, because I know Satan wants me to get critical and fed up and bitter and judgmental, and I just don't want to do that. I want to uh, be a help and try and be that peace that he's supposed to give and does give in me. So thank you so much for those kind things you said. Uh, we'll pray for your fast. Yes, I can't tell you how many times I thought today about, oh, well, I'll go home and eat. And I thought, no, I'm not going to go home and eat that roast or whatever I'm on my fast. So I'm going to try and make it through this whole week. If I get 3 days done on a water fast, that'll be good for a 70-year-old woman working full time and doing her workouts. So, but I'll try and make it 5 days. Let's see. Tiziana, hi, Dr. E. I have an astounding amount of patients who were put on low-fat meats because their doctors told them that eating saturated fats raise the LDL. Is this true? Well, it could be true. Very often, I find over the many decades that eating saturated fats from meat and chicken with the skin on it, and fatty fish like salmon and tuna. These are associated with usually a lowering of their LDL, largely because they're eating far less starch, carbohydrates, grains, and sugars and fruit sugars. But there are what we call lean mass hyper responders that have very good body fat percentages, and they're very lean, and they tend to have a small group of them have high LDLs. But then you have to ask, what evidence are you worried about for LDL being a concern and predictive of heart disease? And the answer is, it's been studied and well established now that LDL is not, and I say again, is not associated with any significant predictive risk factors for heart disease. Instead, and I give God all the praise, it is truly the triglyceride and HDL numbers in your lipid profile, the HSCRP inflammation factor, and the hemoglobin A1C, long term blood sugar stickiness, and your fasting insulin that are far, far more predictive of heart disease. Maybe also getting a coronary artery calcium score to look for calcium deposition in the coronary arteries. And to work with a cardiologist that is up to date on looking at these kind of numbers. We have been so blessed here, and I have been blessed. My dad was in food research, and I have just been able to stand on the shoulders of so many wonderful people in medicine and research before me. Remember, the PhD who isn't seeing the clinician patient load is doing a lot of research. And if they're not bought off by pharmaceutical interests, and they're doing it out of good health and good motives for humanity, the health of humanity, it is these good, the, they are the good doctors, PhDs, that are helping us to get validation of the research on these lab values that are far more predictive. And if you do any research into the whole corruption of the payoff of the sugar industries hiding the true fat research, because we're made of fat, we're not made of plants and vegetables. We get micronutrients from them, and they're valuable. In other words, I take Juice Plus for the polyphenols that we get from the fruits, vegetables, and berries. But I don't eat the fruit, vegetables, and berries because I probably have had enough for 2 lifetimes already in my life of 72 years. So I'm going to do everything I possibly can to keep excess carbohydrates, starch, and fruits limited in my life and exposure. But LDL, probably the best YouTube to look at this and look at a review of the retrospective meta-analysis, Cochrane studies like that, would be the YouTube called High Cholesterol is Healthy. High Cholesterol is Healthy. And that's with Dr. David Diamond, PhD, and then a clinician medical doctor, Ken Berry. And that's about an hour long, and you'll see all the studies reviewed. It was done last year, so it's a very good review. Todd says, have you heard of microdosing the new weight loss drugs like Ozempic for rheumatoid arthritis? No, not for that in specifics, but for autoimmune diseases, I've heard of it as a general umbrella area. And again, why would that possibly be so? If you are having less of an appetite, and your appetite is dropped because you're stimulating your GPL uh, uh, receptors, and that sends a appetite suppressant feedback, then you're going to be eating less. And when you eat less, you're taking in less triggers, which we call food lectins, food allergens, food anti-nutrients that are usually associated with amplifying all autoimmune gut membrane, leaky gut inflammation. And it would help improve all inflammatory conditions. And that's why All right, let's go back to some of these emails. Michelle asks, what helps with memory loss to stop it or slow it down? Exercise, natural hormone replacement therapy, a low carb diet, rich, healthy fats and proteins, vitamin D, uh, and adequate hydration, good night's sleep, stress reduction, iodine will help with that, those kind of things. Julianne says, what are your thoughts on low dose naltrexone to build the immune system? Was on it 15 years ago or so, and I do remember I did have my mood was lifted, but have no idea if anything of our immune system improvement. I do have autoimmune condition. Well, part of low dose naltrexone, that's uh, naltrexone is a bit of uh, uh, a agonist, antagonist modulator for opioid receptors, and that generates feedback information for neurotransmitter production. And this can be associated with mood elevations. So, low dose is being studied on many, many different levels due to its receptor effect on opioid receptors. So, I can see how it may help with mood. It's also often associated with autoimmune disease trials, clinical trials on inflammation from the autoimmune. And that again also has to do with the neuroreceptors in the gut, leaky gut for Crohn's disease. It seems to be helpful in Crohn's, rheumatoid arthritis pains, because all of our cells tend to have opioid receptors for pain management or pain transmission, neurotransmission. So it's not surprising that we see this. But again, can we achieve this without a prescription? How about we do a trial of giving ourselves maybe a fast, like I'm trying to do a 3 to 5 day fast right now. Every time my husband, who has a O positive blood or O negative, I forget, but his O type blood is very sensitive to wheat and grains, oats, rye, barley, and it will make him stiff. And that autoimmune leaky gut phenomena will give him even gut symptoms. So if he'll fast for about 2, 3 days, water fast, then his hands become nimble and he feels much better. His mood is better. His gut is better. And so these anti-nutrient, all these plant phytochemicals that are anti-nutrients, um, are just inflaming. And so maybe the better way to get pain relief, mood elevation, better gut, better everything is to go on a water fast for a couple of days, and talk with your doctor about that. Not if you're a type 1 diabetic that's brittle on insulin injections every day, but in general, the population, if they were on a diet that's anti-inflammatory through a water fast for a couple of days. And then if you went on the carnivore diet, which he does, then he'll do that for weeks, and then he'll feel much, much better. So, yes, of course, I'm going to say low dose naltrexone is going to be modulating opioid receptors all over your body, but why use a drug? And isn't that impressive? I'll just tell you my clinical impact of observation of patients who have been increasingly over the past maybe 20 years on low dose naltrexone for various issues is not impressive. I have not seen a big aha from the clinical experience of people using low dose naltrexone and opioid receptor medication to modulate it. Harvey, Dr. E, what do you think about colloidal nanosilver as a mouthwash? Thank you. I think it's very good, especially when you're getting dental work done pre and post, and maybe a day or two if you're major oral surgery. But remember, we need good, healthy bacteria. We have a biome in our oral mucosa too. And I would not want to kill it off with just nonstop antibacterial, antiviral, antifungal effect of nano or colloidal silver products. For short term, yeah. Dolores says, today I saw my eye doctor. He's concerned for glaucoma. He wants to see me back in 6 months. Any advice or suggestion? What can I do or take? Pray your family had a blessed Labor Day. Thank you very much, Dolores. Well, Dolores, I had a patient here 2, 3 years ago, and maybe it's 4 or 5, time flies, but in the recent past 5 years, and she had such bad eye pressure that her ophthalmologist was going to do urgent surgery. Let's say it was an emergency, but very high concern for surgical intervention. And I told her to go on a carnivore diet immediately, absolutely, not eat late, drink half her weight in pounds as ounces of water every day, to get EDTA chelation with the high dose vitamin C and the minerals and B vitamins that are in it. And she did that 2 or 3 times a week. By the time she went for her follow up with the doctor, she had been given eye drops, of course, on the initial visit when she found it. And I think her eye pressures were like 24. One was a little lower, but it was very high. And she was having some blurring, and we're concerned that that pressure will impact the optic nerve and put pressure on it and create the vision loss over time. That's why they want the pressures down so quickly. Well, when she came back, even after just a week, because I think her follow up was in a week later, the ophthalmologist was absolutely flabbergasted at what her eye pressure was. And I've had people with macular degeneration. That's another type of eye disease breakdown. And the same thing, they would go on a very low carb or carnivore diet and the EDTA chelation, and they were getting injections in their eye of Avastin, a prescription drug that helps stop the revascularization and growth of capillaries and blood vessels. And that doctor was giving the injections 2 or 3 times a week, and then it dropped to once or twice a week, then it dropped to once a week, then twice a month, then every 3 months. And that ophthalmologist was amazed at how this woman, who I think is now 88 years old, and has still been able to remain in independent living and driving. It's just amazing what improving the microcirculation through EDTA chelation can do for the human body for all diseases and all conditions. Um, Shay says, I recently had a blood test. There is an indication that there is blood in my urine and my white blood cell count is low. They have been low for the past few years, the white blood cell count, I assume. The numbers have been going up and down the past few years. Can this be due to stress? Well, the answer is yes, because stress is high cortisol. Cortisol is catabolic, and it is a breakdown type of impact hormone, and chronic breakdown catabolism in your body is not what you want. There's a place and a season for it short term, but chronic stress is no good. Um, the environmental pollutants, usually, again, talking about EDTA chelation, when I give EDTA chelation, I always see the white blood cell count go up. And if you do it very sparsely, you're not going to see the movement. At least it won't be as low as before. But if you do chelation once or twice a week for, let's say, 30 IVs, and within the year, say within 8 to 9 months, we recheck it, we always, it's never good to say always, but I would say the vast, vast majority of patients see the total white blood cell count go up. Why? Because we've lowered the oxidative stress of the heavy heavy metal toxicities, creating free radical damage. So that's my thought on that. For you. Now, as to the microscopic or blood in your urine, you need to work with your urologist on that, uh, and have that followed up. That's not something to be ignored, but do follow up with your doctor. Um, Constance says, "Have you ever eaten yak? Y-A-K." No, I've never eaten yak or elk or venison. I have had venison. Um, I am okay with bison and lamb, but thinking these others might taste too gamey, but so good for us. Well, yeah, because they really don't get the pesticide, herbicide, fungicide that can be in the grains and the hormones and the antibiotics for sure. But no, I haven't had yak or elk. I don't think I've had. Maybe I've had elk and venison from the deer, but yeah, yak is a domesticated cattle. I think that came from like Afghanistan. It's a long-haired. Yaks have long hair. They are cattle with long hair. Sandra, my friend has Pseudomonas in his lungs per the Mayo Clinic infectious disease doctor. It has colonized, and there is no additional antibiotics to take as he has taken them all. Can you suggest anything to help his breathing and energy? Sandra, I would have him seen by a good functional medical doctor who's familiar with ozone therapies such as hyperbaric oxygen, definitely ultraviolet light irradiation of the blood with ozonation of your blood, and high dose vitamin C will definitely be a benefit. High dose vitamin D for a short season, monitored by the medical doctor, and rechecking blood levels within a couple months, as well as zinc, doing mineral assays, antioxidant assays. And of course, it's always wise to go on a low carb, protein rich diet and not eat past 3 o'clock in the afternoon in general, and drink enough water. Uh, Vivian says, my mom is now experiencing numbness in her legs from the shin on down, including her feet. She thinks it may be due to newer medication, gabapentin, but she sent me a complete list to ask you if any of these could be causing this. Okay, so she's on gabapentin, which has the effect of impacting calcium reuptake, and that would be associated with uh, nerve tingling, numbness. She's on metoprolol, which is another nerve or receptor beta blocker. She's on tizanidine. Tizanidine is a medication for muscle cramps, a uh, uh, calcium positive charge manipulator of the flow of calcium in the channels for calcium. Amlodipine is associated with edema. Pantoprazole is a hydrogen ion pump inhibitor, and that'll be associated with poor digestion, which means low magnesium, low B12. All of these impact neurotransmission and sensation, even calcium, even bone fractures. Tramadol, uh, that's a weak opioid, another nerve transmission agonist, and she's on baby aspirin platelet inhibitor. So she's on quite a cocktail. You have to remember, you are a guinea pig. Nobody has done any studies on gabapentin, metoprolol, tizanidine, amlodipine, pantoprazole, tramadol, and aspirin all together in one human being. No one's ever studied the cross reference, especially in older adults. And getting this impact on the transmission at the nerve receptors and cell membrane receptors is absolutely a problem. So I would say definitely it's related to her medications, and she needs to work with her doctor about how seriously she needs all of these, uh, um, and try and improve the nutrition to her lower extremities. Hence, EDTA chelation would be a very good idea to start with, working with a good functional doctor, trying to find one. Diane says, I'm a 67-year-old woman who is postmenopausal and wonder if you would recommend some low-level testosterone, and if so, how much? Yeah, absolutely. My testosterone level is like 170. I use DHEA alone, DHEA, dihydroepiandrosterone, and I take 50 milligrams a day, and I convert the DHEA into testosterone, and that gives me that level. The ranges on the labs are ridiculously low, and they let your muscles become atrophied and shrink away and dissolve away. So I'm for DHEA in everyone past the age of 40, for sure. Testosterone can be given as a cream. I have some women who are on DHEA and they just don't build up their um, testosterone. They don't convert to testosterone. So I give it to them as a cream. And I'll start with 1 milligram a day topically, up to maybe 4 milligrams a day. And I do a retest on their labs. So hopefully that answers your question, Diane. Carlos says, blessings, Dr. Ellithorpe. What are your thoughts on taking anti-parasite medicines such as ivermectin to treat cancer? There's an increasing volume of the value of the many biochemical known pathways where ivermectin inhibits cell replication of these tumor cells. There's at least 9 known pathways where ivermectin stops rapid cell production and turnover. And if you can stop them from turning over without the harmful effects, like radiation will stop it, chemotherapy is a poison, these kind of things will stop it. This seems to be not harmful to our regular healthy cells. So that's my thought on it. But if someone has cancer, they should be treated by an oncologist who's informed on these things. Charlene has 2 questions. Good evening, Dr. Ellithorpe. In conversation with type 1 diabetics, they believe they need 30 carbs per day to prevent low blood sugars. Can you speak to this fear as we see shows where people have to have sugar or go into a coma, etc.? I believe cutting out carbs would be more beneficial. And she also says, can you speak to sarcopenia prevention and reversal? This seems to be a growing problem. Well, to the first, I would say I don't have enough time to get into it in detail, but I have many patients that are type 1 diabetics or they're on the insulin pumps, and we have them on the ketogenic, low carb, or carnivore like or near carnivore diets, and they do very, very well. So instead of having wide swings to their blood sugars, they are much more titrated into a stable zone, and it is the wide swings on the blood sugar damage that is the problem. So if you can have a continuous monitor, glucose monitor, work closely with your doctor, and have a health coach like our nurse, and start to gradually incorporate more protein, digestive enzymes, exercise, not eating late, and uh, reduce the carbohydrates, especially the simple carbohydrates, and move toward a more protein-rich diet, a more ketogenic-like diet. We have many patients who do that very safely and very effectively. But that is a topic of itself and needs to be managed with and worked with a healthcare provider familiar with these things. Sarcopenia is the low muscle mass. Really, the branch chain amino acids, leucine, isoleucine, and lysine, I believe valine. I forget which one now, the 3. But these branched chain amino acids are very valuable. Exercise is very resistance training, especially is very valuable, and not eating late. So that's a simple, quick answer, Charlene. And then let's see if there's anything microdosing of Ozempic for rheumatoid arthritis. I answered that. Garden Fairy says, what do you think of low dose naltrexone? Well, I just answered that earlier up in the question. You can rewind this or look at the blog and look for that question answered. Where do you get your meat for the carnivore diet? I go to Sprouts and I typically buy their grass-fed beef there. I also have a service with ButcherBox or Merriweather Farms, but I have so much meat I haven't finished eating it. I've stopped my subscriptions because my freezer is full. Whitlock says, hello, dear Dr. Rita. Thank you. Please comment on your opinion of DNA SNPs, which evaluate methyl-tetrahydrofolate and other methylation issues such as coenzyme COMT. Do you see these as valuable tests? Not really, because a third of the population is really suffering from these SNPs of the genome that have trouble with methylated uh, processes in the body that is very valuable to prevent heart disease and cancer. So just take a very good methylated B complex, a reputable source, and be faithful with it. And that's about the best you can do. And then Mono says, thank you again. All right, so we've gone 5 minutes over, so praise the Lord. Remember, try and like and subscribe, and we'll see you next week at 6 p.m. To 7 p.m. on Tuesday. We do this every Tuesday, 6 to 7. And love on people. Remember, the love and the infrared and the impact you have hugging people is so immuno enhancing, immuno supportive. I pray that you get it. And if you don't get it, then just, for me, I read my Bible and I get all the hugs from the Holy Spirit. All right. Take care. God bless, folks. See you next week. Bye bye.